Hello, and thank you for joining today's Quality Payment Program Developer Tools and EHR's listening session. Today, our presenters are Jonathan Sullivan and Mari Miyachi from the QPP Developer Tools team. They will be providing an update on the state of the program's developer tools, share the vision for EHR API submissions, and solicit feedback. CMS encourages participants to provide feedback throughout the presentation. To do so, please use the Raise Your Hand feature and CMS will unmute your line. For those dialed in via phone, you must have your audio PIN entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone. Now, I would like to introduce Jonathan and Mari. You may begin.
Thank you, and thank you to everyone for joining us today for this call. We're hoping to have an interactive session where we get some feedback from you all about some things that we've been delivering and things that we're contemplating delivering in the coming year. My name is Jonathan Sullivan. I work for the U.S. Digital Service, and I am a product strategist who's been working on the quality payment program, specifically around the program's platform for API submissions. And my colleague today on the phone is Mari Miyachi, and I'll let her introduce herself.
Hi everyone, I'm Mari. I'm an engineering manager who's been working alongside Jonathan on the quality payments program, specifically on the API. So really interested in hearing more about how EHRs want to integrate.
Okay, let's take a look at our agenda for today. If you can move to the next slide, please. So we've got 4 things that we wanted to cover today. Back one more slide, please, to slide 2. We've got back one more to slide 2, please.
Sure, no problem. Sorry, we're just having a technical difficulty. I'll switch back.
Okay. So we've got 4 things that we want to cover today, and we'll try to get through all of them, but we've kind of prioritized them in order so that we can make sure that we have time to at least cover the things that we're most interested in covering today if we can't cover all of them. One is that we just wanted to give you an update on where we are with existing QPP developer tools to make sure that everyone is aware of the tools we've created to date. The second is that we would like to take a few moments to gather some feedback from you about those tools. The next agenda item is that we would like to share our principal challenge with regard to EHR submissions via the API and talk about what we feel is the best solution for that challenge, and then spend time getting some feedback from you all about that. Our goal is to try to understand as much as we can about the EHR submission model from the perspective of EHR vendors and their customers so that we can deliver an API that works well for you. And lastly, we'd like to give you an opportunity to provide us input on what kinds of developer tools we could put together for you to help you and your customers in the coming year. So let's start with a status update on our existing QPP developer tools on slide 4, please. So since the inception of the quality payment program, we've had a very developer-focused mindset, and we've had 2 major tools that we've delivered in the first year of the program. The first was our measures data repository. This is an open source code base that contains information about the QPP measures. This is something that you can download and import the code package into your own software so that you can programmatically work with the QPP measures data. In the past, you might have had to scrape the PDFs that QPP publishes or that CMS publishes or that measure vendors publish in order to program these measures into your software. With this repository, you don't need to do that. You can directly access this library of all of the QPP MIPS measures. The second thing that we delivered in 2017 was a QPP submissions API. We developed this in conjunction with many of you who are on the phone today. We've offered this in a number of different flavors over the course of the year. So the API started out with a public developer sandbox that was released in March of 2017. At that same time, we also provided interactive Swagger documentation on the QPP website and steadily added more and more developer documentation on the QPP website and a special developer tools area. We also started our QPP APIs Google group, where you can ask questions and get answers, not only from CMS, but from the other folks, the other developers that are actively using this platform. And we also offered a developer preview, an authenticated developer preview for 2017 qualified registries and QCDRs. So moving on to the next slide, there are some things that we wanted to ask you with regard to these tools that we've provided so far. Understanding that with regard to the submissions API, we've definitely heard loud and clear and are well aware that EHR and other health IT vendors would like to be able to use the API. And that is the next agenda item up on our list here today. So we do know that people have that feedback, but what we'd like to do today, before we get into that, is just take a moment and see if there's feedback on the measures data repository or the public sandbox that we provided for the submissions API. And some things to think about that we would be interested in hearing from you on are, how do you use these tools today and how might we improve them? So we can open up the phone lines at this time, and as they indicated at the beginning of the call, just raise your hand to indicate that you have a question or you want to make a comment, and we'll open the line for you.
We will stand by for our first question.
So again, with regard to the measures data repository and the public sandbox or the submissions API, how do you use these tools today if you've been using them, and how do you think we might improve them in 2018?
As a reminder, to submit your feedback or ask a question, please raise your hand and CMS will unmute your line.
I guess I should have planted some audience questions.
All right, our first question comes from Swithin Chandler. Swithin, your line is now unmuted.
Hi, Mary and Jonathan. Yeah, I'm sorry, it's not really a question. I was waiting for someone else to ask this, but I guess I can't provide any feedback on that because the types of doctors that we serve, we can't use this for them. I think if we could use this API to submit quality measures, we would actually be using it, and then we could provide you some feedback today on some of that. And I don't know if that's what you were referring to when you said you were going to talk about that later, but there's that threshold, right, of you have to have so many providers or clinicians, submitting as a group or something like that to be able to use this tool. It seems like a fantastic tool. I'm really glad you have it, and I appreciate you having this webinar today. My primary question for attending this, it really is to know if you're going to enable individual providers or smaller groups to submit to using this method. Thanks.
Thank you. So we have others who have comments or feedback?
I believe that is all that we have at this time.
Okay, well, why don't we move on to the next thing on the agenda, which I think is the one that's most compelling to people, and certainly the one where we have the most need for your input. So going on to slide 8. So in this next section, we'd like to talk about EHR API submissions. As many of you know, in early 2017, we anticipated offering the submissions API for both registries and EHRs to use for QPP Program Year 1, 2017. However, over the course of the year, we came to realize that the EHR submission model offered a unique challenge, and that with finite time and resources for our API effort, we wouldn't be able to offer the API to EHRs for Year 1. And we realized that that was very disappointing news. And as I've said on prior webinars on this subject, it certainly pained me to come to that conclusion, but that was the reality of it, that we just weren't going to be able to do both in Year 1. So why is that? Well, the challenge surrounding EHR submission via the API is related to authentication. QPP submissions and scoring are authenticated transactions. The transactional model for qualified registries and QCDRs is very well defined with clear lines of accountability and transactional integrity. EHRs, on the other hand, offer a wide range of transactional models, and the lines of accountability and transactional integrity are neither well defined nor common. For example, there's several different ways an EHR might be implemented. There's the cloud model, where there's one instance of the software that's shared by hundreds or thousands or even more users. There's another model, the on-premises model, where an instance of the software is installed and deployed for a health system or for a practice on a local basis. And a vendor with an on-premises model may have numerous versions of their software out in the field, all being used by customers at any given time. Another model is the shared instance model, where there's an instance of the software that's shared by one or more entities. Those entities might be from the same health system. They might be different hospitals or groups in the same health system, or they could be different ones. And there's also an open source model. There's at least one open source EHR that we're aware of. So simply applying the registry authentication model, we realized would not work. Would not work for all of these different ways in which EHRs are deployed and used. So we realized that we needed to come up with an authentication model that would work across all of the different EHR models. So we have an idea about how we think this could work, and we'd like to share that with you today and get your feedback on it. Just to be clear, this is a direction that we're thinking of going in, and part of the reason for having this call is to get some validation for that direction. We're not saying that this is exactly how it's going to work or making a product announcement today. Instead, what we're trying to do is get some feedback. Before I get to that, I'm realizing that I accidentally skipped one very important slide, and that's slide 4. So I'm sorry, if we could just backtrack to that real quick. I wanted to make sure everyone was aware that since the inception of the quality payment program, our product development is centered around several guiding principles, but there's 2 which are particularly relevant to what we're talking about today. The first principle is API first. And what this means is that we designed the technology platform for QPP from the ground up based on APIs. And while this is probably what you would expect as a group of software development companies, this was a fairly novel approach within CMS and within the government in general. So nearly every aspect of the platform has an API, and all of the customer-facing applications that we've developed for QPP use those APIs. For example, our QPP submission user interface on the QPP website, where you would go to do file upload, is built atop the very same API endpoints that we've made available for use by third parties in the sandbox and in the developer preview. So to use a Silicon Valley expression, we're eating our own dog food. So we're looking to expand the availability of those endpoints and possibly even open source some of them in the future. So API first is an important principle. The other important principle is design with users, not for them. This means that we engage with our users continuously throughout the development lifecycle to ensure that the software we are building is aligned with their needs. So with regard to the submissions API, we've done this by providing the public developer sandbox since March of 2017 and the developer preview since July of 2017. By enabling users to start working with the APIs as we were developing them, we were able to get bug reports and feedback, which helped us deliver a product that was more closely aligned with users' needs than we would have if we developed it without that input. So this is a practice that we intend to continue, and so today's meeting is an example of how we're trying to engage users early and often in the development process. So that's what brings us to this discussion about our EHR authentication challenge and how we're thinking we might be able to solve that challenge. Before we start writing code or commit to this path, we would like to hear from you, and this webinar is one way that we're going to gather feedback. So if we could go to slide 9, I can walk you through what we're thinking in terms of our authentication model for EHR submissions. So we're envisioning using OAuth, an industry standard authentication model to authenticate EHRs. I'm sure as many of you are aware, this is a common authentication model that's used across distributed software platforms. You probably use any number of these on a given day. Using your Facebook credentials to log into a website is one example, or your Google credentials. Allowing Dropbox to access your LinkedIn profile. Allowing Evernote, for example, to access your LinkedIn profile. All of those transactions are one system allowing you to grant that, so you as a user to grant that system access to some information or perform an activity on your behalf in another system using your credentials for that system. So, for example, the common example in social media is allowing one product to post something to Facebook on your behalf. And in order for you to allow that product to do that, you're required first to enter your Facebook credentials and acknowledge to Facebook that you want to give this application access to your Facebook profile and give it privileges on your behalf on the Facebook system. So you can imagine that in an API submission model that we could do a very similar thing. So your app, your EHR, when your user is in the EHR doing their work in the EHR, ideally we'd like them to be able to do their API, or sorry, do their QPP submissions without ever having to leave their EHR. They can stay in that home environment and do their submissions from there. So you can envision that a way that we could do that would be to provide a way for a user to indicate that they wanted to submit some data that would trigger that would trigger the QPP program platform to present an authentication dialog box where they would enter their EIDM, user ID, and password. And then that would be our way of authenticating them and knowing that they were giving your EHR application permission to submit on their behalf and to see their score. So once they had authenticated, we would redirect them back to the EHR, and then they'd be able to continue on with their transaction using the authorization code that your app had exchanged for their EIDM credentials. So I'm going to stop talking for a minute and just give you all a chance to absorb this a little bit. And then what we like to do is open up the line, and there's a couple specific I mean, there's a number of, we just like your feedback in general, but the things that we think would be good for you to think about and share with us are, in general, what's your feedback or concerns that you might have about this approach, what you would need from CMS in order to integrate this API that was structured this way into your software, how far in advance of the submission window you would practically need it. Would you roll this out to your providers? And what do you think would be the benefit to your providers versus the existing file upload approach? So those are some things to think about. We'll keep this diagram up on the screen. We'll open the line and give you the opportunity to chime in at this point in time.
If you would like to provide feedback, please raise your hand and CMS will unmute your line. Paige Devi, your line is now unmuted.
Yeah, I just have a question. So I think this sounds really, I'm actually all for this. I think it sounds really impressive. My question is if we go about this route, I'm coming from more of a, not so much a programmer standpoint, but more of like a customer support standpoint. What if, you foresee there's issues with like the interface or, the connection to CMS? Are you guys planning on providing stable support on your end to help us with that, or direct do you know what I mean? So that we feel like we have the support to support this API. Does that make sense?
Yeah, absolutely. That's a very valid concern. Just to play that back to you, the way that I heard it and the way that I kind of think about this is that for you as an EHR vendor, if you're building this functionality into your app, and one of your customers is using your app and they're going to use your app to submit, this functionality that we're providing where they authenticate has to work, right? If it doesn't work, then that looks to your customer like there's something wrong with your app. And we understand that puts you in a bad position, right? And so they're going to call you, most likely, is what's going to happen.
Right, exactly.
So one of the things that we would want to, I think one of the aspects of this that would be important is to, well, first of all, CMS would need to provide support for the authentication pieces of this, either directly to users or to you as an EHR developer that was integrating with this. But since we're talking about like the point in time at which a customer encounters an issue, one of your customers or provider encounters an issue, I could envision that one way that we could do that is that when they go through this authentication process, that maybe they're using a dialog box that is served up from CMS that has our content and our branding on it, so that so that we can explain to them, this is where you enter your EIDM user ID and password. And if you don't have a EIDM user ID and password, click here to learn how to get one. If you're having trouble doing what's in this dialog box, contact the QPP Service Center. So I can imagine that one way that we could do it is like you hand over the user interface to us during this transactional process so that we're providing prompts to the user, which we think will help them complete that part of the transaction, and which directs them to us if they're having difficulty with the transaction. I could see us doing it that way. I'm not sure that I could also see, or maybe that might be that might make it more difficult for you as an EHR vendor to implement something like that. Maybe it's easier if it's all behind the scenes and it's just embedded in your product. But even you would have the ability to kind of visually differentiate or provide help text that might get them over a potential issue. Because I think, if they're having trouble entering their EIDM credentials, that should be on us, not on you. And anything we can do to make, to guide, to bring them to us in that scenario would be better, I think, than having them go through your help desk.
Okay, no, I like that. That was really my only comment at this time, so I think I'm good, but I appreciate that information. I just wanted to make sure that that was at least an item that was addressed and thought about, so I appreciate it.
Thanks. And if others have a different point of view on this or another aspect of it that they're concerned about, this is your opportunity to speak up.
And then Shane Gerald, your line is now unmuted.
Can you hear me okay? Hello?
Yes, yes, we can
So
hear
my
you.
question is just the token, like expiration. Will it be a lifetime token? Will it refresh every 2 weeks? What's the idea with that?
That is a good question. We don't have a firm idea on that. To me, 2 weeks sounds like a little too long, but I don't know. That's one of the many areas where we would like to hear what you think would be practical in terms of user experience. So what would be your recommendation to us for that?
Well, Facebook is a lifetime. So, I mean, that's like the most convenient, but I'm not sure it's coming from a provider. Somebody in customer service might have a better idea of that.
Yeah, I mean, lifetime, we would not, I think it's pretty safe to say we would not do lifetime, but given that the program right now has a 3-month submission window, I could see us doing maybe 3 months or possibly longer if we want to think about like including the feedback window and that. But yeah, anywhere up to 3 months is the kind of the time frame I'd be interested in hearing from people about if they have a strong opinion one way or another.
Gotcha. Thank you.
Tammy Mickelson, your line is now unmuted.
Hi, yes. So we're an EHR, and we have a module that is a reporting tool that clients are in daily, monitoring their items for attestation and throughout the year. And you kind of mentioned it on this last caller that this API is for the attestation period each year versus real time throughout the year. So I wanted to just verify that this process that you have in place is during the attestations period.
Yeah, so so let me just address a couple of things. So the way that the macro rule is written, there's a 3-month submission window, and we've heard from a lot of people that there's interest in the marketplace in having continuous submissions. Unless the rule is rewritten to allow that, we won't be able to offer that unless the rule is rewritten. And because of the time lag between writing a rule and having the rule take effect, we'd be looking at year 4 before that would realistically happen, I think. So what happens between now and then? Well, between now and then, we have a fixed submission window that's 3 months long, and that's the period of time you have to actually submit data. But it seems like the market is very interested in being able to understand where providers stand at any given point during a program year. So right now it's calendar year 2018. Right now, providers are performing activities that will end up being part of their 2018 submission. And they might like to know, like, where do I stand 3 months into the year? How am I doing, right? And so a scoring endpoint that would allow you to submit a set of data that we could then give you a score on. We're not storing or retaining the data, but it's kind of a way for you to see or give information to your providers, like how are they doing. I could see us doing something like that. The rule doesn't prohibit that. And in fact, we do have a score preview endpoint that's available right now. So the model that you see on the screen on slide 9 is the model that we would envision being in place during the submission window. I think it's an open question about, is the score preview endpoint one that we feel the need to authenticate on? That's still an open question. Right now, we have an open one. There's arguments to be made for making that authenticated as well. But we would envision what you see on the slide as being the model for doing submissions that are going to be official, that CMS is going to store and score to give them a payment adjustment for a program year.
Brandon Roberts, your line is now open.
Hi, my name is Brandon Roberts. I work with an EHR as well. One of the questions that I would have about this particular setup is, and I may have missed the plot, so I apologize. One, we work with a validation utility to make sure that when we submit files that they are at least in structural order. But it's happened most years where there's something that is missed within the validation, so that when we actually submit those files to either CMS or this year QPP, that there's additional errors that weren't accounted for. So one of the things that I was wondering is if this sort of scenario where we're able to utilize the API to submit from the application itself, if that would be something that we could do for, let's say, testing purposes, or if there would be a separate sort of setup that we could actually test at least the file structures outside of the submission period, so that we can kind of get a jump on this stuff, so we're not kind of hanging out in the wind, which we kind of are right now.
Yes, so we've got a couple of tools out there right now that address the kind of need that you're talking about. One is the public sandbox that we have, where you can do an unauthenticated submission and using fake TINs and MPIs and get that validation feedback, find out if your file is structurally sound and will be accepted. That's one thing that's available to you. The other is that we have open sourced our QRDA3 conversion tool. This is a tool that we use internally inside the platform to allow us to accept a QRDA3 file. Behind the scenes, we translate that into the native format of the QPP platform. So we open sourced the converter tool so that you can also test or even embed in your own software, if you want, the ability to convert QRDA3 to QPP JSON. So those are two tools that we have available today. We've heard from the marketplace that they would like to have an authenticated developer sandbox in which they could perform similar activities to the public sandbox, but with real data, real TINs and NPIs. And that's something that we're working towards offering for 2018. And I could conceive of a model there where, maybe for this developer preview environment for EHRs, I could see a model where maybe you get an API token that you can use for that environment that would allow you to more simply sort of just do some of these kinds of tests. Now, that would not include being able to test the workflow like you see on the screen right now, but that would be another thing we could talk about, is whether there would be value for EHRs in having maybe like an initial opportunity to simply do the submissions testing with real data, real TINs and MPIs, and validate that they can submit that data accurately. I could see maybe doing something like that as an interim step towards an authentication model like the one that you see on the screen.
For the development, like testing resources you mentioned before, where can I find those, or can you add a slide or show a slide at some point during the presentation of where those can be found?
Yes, I think maybe a slide got put at the end that had that, but let me double check here.
Perfect.
What you can do is you can go to qpp.cms.gov/developers. And on that page, you'll see links to our more detailed documentation as well as our Google group. So it's qpp.cms.gov/developers. And from there, you can find your way to the sandbox, the public sandbox, and the documentation.
So hopefully the last question that I have is, with those utilities, would I expect to see more robust errors presented for whatever structural issues that we're having, or would it be the same sort of errors that you would get with straight submitting?
It would be the same. You'll get the same. You're going to get exactly the same messages back. Okay. Because what we tried to do with both of these environments, the developer preview and the public sandbox, is use the same thing that actually is being used by the production system. In this system, we have endeavored to provide detailed, helpful, actionable feedback. So my understanding anecdotally from prior programs is that you either got the feedback, you either didn't get any feedback, or the feedback that you got was inscrutable or so minimalistic as to be unhelpful. So that is not the approach that we've taken with QPP. The approach that we've taken is to have a library of useful, helpful, actionable error messages that you get that help you figure out how to quickly correct any errors that you might see.
Okay.
And we provide that both in production and in the developer environments.
Okay, so one of the issues that I'm having right now is that the error that I'm receiving back, having gone through it, isn't telling me what the issue is, and so I'm having to go through support and work with, hopefully, eventually your dev team to figure out what the error is actually saying or what it's actually pointing to, and so something that is more robust than just, hey, we can't find your aggregate count, would certainly be useful if possible.
Okay, that's helpful feedback. So one of the things that we've learned so far is that people get errors that are related to the measures that they're submitting or the way that they've submitted the measures. And you all are, I think, generally more aware of it aware of this phenomenon than I personally have been, because I don't have as much experience in this as you all do. You guys have been doing this for years. The measures can be tricky. And so one of the things that we've been trying to do as we learn more about these types of measure errors is be able to provide either better messaging back when these errors are encountered, or to do education and outreach to help people understand how the measures work. I think part of the problem also is that we're in the first year of a new program with some new measures. And so there's a certain amount of everybody getting used to how the new system works, and maybe next year we won't see as many of these. So even though it's a pain in the neck, I do appreciate you opening up tickets for things like that. Help us understand where the pain points are, and that way we can try to address them and hopefully just, continue to improve the robustness of the feedback that you get.
All right, appreciate it.
All right, Devin Gentilesco, your line is now unmuted.
Hi, can you guys hear me?
Yes, we can hear you.
Okay. So we had a question about this particular screen. We operate as a data submission vendor today, and just due to the architecture of how we've set that up to support submitting on behalf of clients, I don't anticipate that using the API, especially in 2018, would change that, and we would still do that submission on behalf of our clients. So would this process be different for us as we're logging in as the vendor rather than the actual client?
So the idea is that these QPP transactions, the submitting data and getting a score back, are authenticated transactions. And that's a different model than the model that CMS has historically used in quality programs. When you describe submitting on behalf of others, what we're saying is in order to do that, they need to give you permission to do that. And the way that we're envisioning reporting that they've given you that permission is by having them authenticate with their EIDM credentials. So the other way that we can handle that today, and this is for file upload submissions, is that we're asking EHR data submission vendors to, on their EIDM account, have a submitter role for each one of the clients on whose behalf they're going to report. So in a way, this is kind of what you're seeing on the screen right now is kind of analogous to that. EIDM, having an EIDM submitter role is another way of them affirmatively giving you the permission to report on their behalf and see their score. This is another way that we're envisioning that they would be able to do it that could happen in real time at the time that they want to initiate a transaction, as opposed to having to do that pre-work of going into EIDM and setting things up there. I'm not sure if that answers your question, but.
So what I'm hearing is that using the API, there isn't going to be a way to bypass that authorization like we've been given this year by using the registry definition, rather than having to have every client grant us access through EIDM. So I don't know if that's something that we could talk about further. I do anticipate that's how we will be performing submissions, and I don't want that to keep us from being able to utilize the API and be able to use that sort of like file format rather than having to go do the manual uploads. But to us, I think getting that authorization on behalf of all of our clients would be quite a burden.
Yeah, and so this is one of the ways in which we would expect to be able to alleviate that burden by offering an authentication model like this. It's not clear to me at this point in time that we can deliver this in time for EHRs to use it for year 2 reporting. Part of the reason why it's not clear to me is because one of the things that we're looking to understand is how far in advance of the submission window opening do you need to have something like this implemented in order for it to be useful to you. So, I've only spoken with a handful of vendors about this. I've heard estimates from 6 months in advance to a year plus in advance. So, depending on what we're hearing from folks, I guess it would be our goal to deliver this as quickly as we could, but if we couldn't deliver it until, say, Q3 2018, does that mean that only some people would be able to use it for year 2 reporting, or that nobody would, or many people would? And it's not clear to me, like, delivering that late in calendar year 2018, how many people would actually be able to use it. So you're asking about what will be the permitted modalities for year 2 reporting, and the answer is I don't know yet, because we haven't sorted out when we think we could deliver. If this is really the model that we're going to use, okay, when can we deliver it? And if we deliver it, then how much relief is that going to provide for EHR vendors? Is it going to be enough, or is their development lead time so long that this is really a year 3 solution for them and we still need to do something else for year 2? So that's my long-winded way of saying that we're still trying to, we're very much aware of the pain points, and how that'll get solved for year 2 is an open question right at this time.
Okay, thank you.
Alyssa Chandler, your line is now open.
Hi. I was wondering, how would behind the scenes data analysis occur? Like in the EHR model, what does the rules engine do now with regard to the preview score and the final submission score? How does it work now, and how would it work in the future?
Can you give me a more specific use case or a more detailed use case, just so I understand what you're getting at?
Okay, so I have an example. We have a client who is looking at the preview score for the IA category, and they're less than 15. They're a small practice, and they're not getting any inbuilt. It's not accommodating their status as a small practice. So they submitted 2 medium weighted, for example, and that should be allowed to get credit, but they're not getting that credit in the preview score, and they're not getting credit actually in the final submission.
Okay, so in this particular case, so right now, today, we are still in the process of implementing some of the more, some of the less common eligibility statuses. So they're a small, sounds like they fit into the small rural underserved category. It could be that the eligibility data for them is not yet getting incorporated into their score, and that's why they're seeing the situation that they're seeing. So what we would anticipate in the future is that there wouldn't be this lag, and that you would be able to, that your preview score would be, again, depending on the time of year, would be accurate, or let's say more precise. So sometimes eligibility rules can change from year to year on the program as the rule evolves. If you've been paying attention to the year 2 rule, you know that there were some eligibility changes that happened with that. So there's always going to be some flux there, but once we get to the end of the year 1 submission window, I think you'll find that the score preview lines up very well with what they get in production in terms of the level of precision for taking into account special scenarios. Yeah.
Sorry to interrupt. So the reason that score preview can't take into account special scoring scenarios is because it's unauthenticated. And so the way that we are able to understand someone's special score, we can only retrieve a person's special scoring scenarios if it's an authenticated endpoint. So like Jonathan was saying, the score endpoint, we are, over the next couple of months, adding more and more scenarios so that like full level of special scoring data will be available. But the score preview endpoint will always use the default. And so you won't be able to apply special scoring scenarios there.
Thank you.
Yeah, thanks for clarifying that, Mari. So, one of the things that we were looking for feedback on today is what other kinds of tools would be useful to you. Conceivably, you could say, well, we want to be able to do we want to be able to do a score preview call, and we know that you can't tell us because you don't know exactly which practice we're submitting on behalf of. We want a way to say, score this as though it was a small rural practice, or score this as though it was hurricane relief, or whatever the case may be. I could see people asking for something like that, and we could try to see how we could accommodate something like that in a sort of generic way. So that's the kind of stuff that we want you all to be thinking about and giving us feedback on.
Justin Colin, your line is now unmuted.
Can you hear me?
Yes, we can hear you.
Okay. Basically, my question I was going to ask is the validation of the 10 and MPI. So if we have multiple MPIs we're submitting for, are you guys going to make sure that all of those MPIs truly do belong to that 10? Is there going to be like a shoot back an error? How exactly will that work? Does that make sense? Or because more than likely we'll be submitting for multiple providers, and we have the MPIs on our side. I don't know how we're going to make sure that we know exactly what you have on your side that belongs to that 10.
Mari, you can correct me if I'm wrong, but I don't believe that we validate that all of the MPIs in a submission are associated with that 10.
Yeah, so this is going to be an upcoming change that we're rolling out. We'll be doing that validation when you call the score endpoint, and we will give you feedback there if the NPI and TINs are mismatched or any other sort of similar eligibility scenarios like that. But we will accept all incoming data regardless of a situation like that.
You'll still accept the data, you said? So when
Yep.
we call for the score, that's when we'll find out if whichever
Exactly.
one. That's when we find out which one
Yep.
fell out.
Yep.
Okay. All right, that works.
All right. Tara Olds, your line is now unmuted.
Thank you. I'm kind of in a different scenario than maybe some of the other people on the call, that we have a homegrown EHR that supports our primary customer. So I wear the hat of the vendor, and also coming from the provider side in terms of trying to support their submission directly from their side. But my thoughts on this is, while I support technical changes as improvement, it's clear to me that we need to get guidance out early. There seems to be a constant lag in notification as to what's going on, or clear guidance on what's being expected. For example, I did have some questions on the API, and the API guidance on the QPP vendor site indicated that API was still the preferred method for EHR until late December 2017, when clearly that wasn't going to be the plan for this year. The EHR wasn't going to be supported on the API. So there's definitely conflicting information out there. And just in general, I think whatever technical plan that is implemented, we need to make sure that the help desk is able to support that. I've had challenges getting accurate technical guidance from the QPP help desk to where they're not familiar at all with any technical questions that I have, or really even just measure specifications. So, as we get more complex in these methods, I think it's critical that the guidance is given early, that it's understood throughout the organization, everyone's on the same page, and the help desk can support what's out there. Another piece that would be good to know is to make sure it's clear if we go this way, is it required Is there any perk to submit via the API, or is there really no difference if they were to manually attest on their own? And then the last point I had is the ACO or people that are participating from the ACO perspective, kind of wondering what the impact would be on those users for something like this this year for our quality submissions, since we're participating as a MIPS APM. We have to do a separate submission for our quality measures via the CMS Web Interface, and I don't know if plans to incorporate something like this would be incorporated across the board, or if there'd still be some kind of split for those people.
Thank you for that feedback on the importance of communicating early and often, and on having our call center representatives be as empowered as possible to answer questions in the first line as opposed to having to go to tier 2 or tier 3. With regard to submissions via the CMS Web Interface, that is built on an API also, and we did consider opening up those APIs for 2017, but we did a little user research and we came to the conclusion that the way that the API endpoints, that there was just, it would be a little overwhelming just to kind of put it out there as is, and that we felt that it would be more valuable to the marketplace based on the feedback that we were getting if we had something that was a little more packaged and bounded, so that it was easier to figure out, okay, to plug that API into an existing workflow. And as you know, it's a very different type of workflow. So what you're seeing on slide 9 would not apply to the CMS Web Interface. First of all, the next step around CMS Web Interface is that we would have to figure out a way to have publicly facing APIs there that made sense for the customers of that product. And then we would have an authentication model that was specific to that, again, that workflow, which is very different than this one. So we hope to be able to offer more API flexibility or API capability around the CMS Web Interface in the future. But that's not within the scope of today's conversation. I don't have any information for you on that at this time. So, but I do appreciate you bringing it up, because it's important to point out that what we're looking at here on the screen is definitely does not apply to the CMS Web Interface. This is for MIPS submissions only.
Okay, thank you.
As a reminder, if you have any feedback, please raise your hand and we will unmute your line. Right, I can go ahead and read some of the comments that we've received through the chat box. This feedback is from Stephen Chandler, and he states that as an EHR vendor, this oath approach looks fine. Authenticated test submissions of real data would be helpful. The standard lead time request per the EHRA is 18 months, but that generally applies to mandatory changes. If you were to make this available as late as third quarter 2018 as an optional approach for the 2018 reporting year, we would still be very interested in using it for the 2018 reporting year.
Great, thank you.
And just some additional feedback from another attendee. They stated that they think having the error responses in the JSON repo would be helpful. As a developer, this would allow them to determine missing or edge cases that may have been missed.
Okay, that's good feedback. We do have error message documentation, but we have not made it public yet. And we've gotten feedback numerous times of people would like to be able to see the universe of error messages that they might get. So we'll take that as an action item to try to bring that to the market.
We have received a question through the question box. Will QRDA3 files still be accepted for 2018 submissions in early 2019?
Yes, for program year 2 2018, QRDA3 will be one of the accepted file formats.
Another question that we have is, where can QRDA converter tools be obtained?
If you go to qpp.cms.gov/developers, on that page, there's a link to the conversion tool, and that's where you can get it from. So again, qpp.cms.gov/developers.
I believe that is all of the feedback and questions that we have at this time.
Okay, so sounds like we're generally getting positive feedback about using OAuth as the approach, and that it's possible that even a Q3 delivery could be viable for at least some of the folks on the phone. What would you need from CMS in order to integrate the API into your software? What else might you need from us that we haven't provided yet, or that hasn't been brought up on the call today? Are there other things that we could be doing that would be helpful to you?
Please raise your hand and CMS will unmute your line. We did receive a question asking, will QRUR reports be available through API?
That is a good question. No, the answer is no on that one because, well, I know we don't have any plans to do that for 2017. The reports are for the benefit of the providers. I'm assuming that the thought behind the question is related to, if we can keep the provider in their EHR and not have to have them go to another place to participate in this program, including getting their report back. That would probably be ideal. I don't know that we'll live up to that ideal for 2017. For 2017, they will be able to get that report by logging into the QPP website.
All right, thank you, Jonathan. As a reminder, please raise your hand and we will unmute your line. There's no additional feedback at this time.
Okay, one more prompt that I'll put out there. Are there other pain points for you or your providers when reporting to QPP that that could be addressed that aren't addressed right now through the API and the conversion tool? In other words, are there other opportunities where we could be providing additional value?
We will stand by for our next caller. Shane Jarrell, your line is now unmuted.
So one use case that came up for us was a possibility of going from JSON to QRDA files. Is that a possibility in the next year, or will that even be relevant?
You mean like going back in the other direction from QPP JSON to QRDA3?
Correct.
Tell me more about that. Like, what's a scenario in which you would use something like that?
Potential use case, like just a user wanting to use the web portal themselves, right? But we've developed a program or application to generate JSON. So having a way to easily give them an XML document from that would be extremely helpful.
Okay, I see what you mean. So keep in mind that when you do file upload, when you submit via file upload on the QPP website, you can use QRDA3, QPP JSON, or QPP XML. So they would not need to convert it to QRDA3 in order to upload it on the QPP website. So I'm not sure if your question was based on thinking that they needed to do that, or if there's some other advantage to them in having that QRDA3 file.
So I was unaware of that, but I guess just the customers, I guess familiarity with the XML and wanting that file, but I did not know that you could do JSON as well. So that would be possibly a way we could, have them go with that instead of the XML file.
Okay, we've tried to make it so that the API and the file upload are, the same in terms of what files are accepted. And in fact, the reason why they're the same is because the file upload actually uses the API. So that's why they're the same. But
okay.
if there's a compelling use case in the market for being able to go in the other direction, we definitely like to learn more about that.
Okay, thank you.
By the way, that's a good example of like something that we hadn't really been thinking about. So if you all have other use cases that are on your mind, like that, or that you think might fall outside the typical, those are the ones that we want to hear about.
All right, we do have a question. And this is asking, CMS requires QRDA Category 3 files for certification of EHR ECQMs based on the QPP file format. Will this requirement still be required going forward?
Yes.
And then an additional question, is there an ETA on providing a sandbox API environment for individual EHR or certified registries?
You mean an authenticated one?
They mentioned either.
Can you repeat the question, please?
Sure. Is there an ETA on providing a sandbox API environment for individual EHR or certified registries?
So the sandbox environment we have today would work for, it does work for EHRs. So I'm a little confused by the question. The sandbox environment today, because it's public and unauthenticated, can be used by anyone. It was the developer preview that we had last year, the authenticated version, that was not open to EHRs. So as soon as we settle on the EHR submission model for API submissions going forward and have something, have a beta ready to go, then we would have a developer preview, an authenticated developer preview for EHRs. But we don't know when that will be yet. It'll be sometime in 2018.
We did receive an additional question. Why or where is the demand for QRDA Category 3 if it is not being used or preferred for submissions?
Well, that's a hot topic. There are certainly some people that I've encountered that would like to, that question why we need to accept QRDA 3. And then I encounter other people that are like, QRDA 3 is the most important file format in the world. The short answer is we accept QRDA 3 because it's a file format that is widely used. People are familiar with it. It seems like most EHRs natively produce that file format. So we do not want to require the market to suddenly adopt yet another file format just to suit the needs of QPP. We wanted to provide the flexibility to allow QRDA 3 submission. It is not our preferred file format because QRDA 3 contains a lot of information that we don't need. So it's for us, it's a noisy format, right? But we recognize that it's something that's commonly used in the marketplace, and if that eases the burden for people to participate in the program and submit data, then that's something that we're willing to accommodate. Would we like to sunset our support for QRDA 3 in the future? It's definitely gotten talked about. I think we would have to, approach that choice pretty carefully and make sure we gave the market plenty of time to cope with that. As far as QRDA 3 as a file format in general, my understanding is it has a lot of other relevant uses that are good reasons for it to exist in the marketplace. But for QPP, it's suitable, but not explicitly designed for this. And what I mean by that is the format isn't designed specifically for the needs of QPP. It's a broad general format that serves a lot of different purposes.
Great. To submit any additional feedback, please raise your hand and we will unmute your line.
We also get people asking us, why don't you support FHIR? The short answer to that is that, at least at the time that we began implementing writing our software, the FHIR standard at that point in time wasn't really set up for quality reporting. And I know that they've come out with a newer version that I think comes closer and that comes more in this direction of providing the ability to do quality reporting, but it's still not fully baked yet. So if people are curious about that, I mean, that's one we're also listening to the market and trying to see where the market is going with regard to FHIR format and watching how that format is developing so that we can figure out if it's a fit for what we're doing and if there's something we can do to help make it more suitable for that.
All right, great. Thanks so much, Jonathan. It doesn't look like we have any additional feedback at this time, so I'll turn it back over to you to close the call.
Okay, so thanks for participating today. I realize that you may come up with more ideas or concerns or suggestions once you've had some time to internalize this. We'll circulate this slide deck to the group. On the last page of the slide deck, you'll see that we have a link to the QPP Service Center. That's where you can direct questions our way. Just indicate that you have a question for the QPP Developer Tools team, and it will get routed to us. We already have a workflow in place for them that works very well. So that is a reliable way to get in touch with us. So we would encourage you to keep the feedback coming. You can also participate in our Google group. Again, qpp.cms.gov/developers will give you the link to that. And we would like to encourage you to engage with us there. In addition to that, we will be having a couple of listening sessions at HIMSS. And these sessions will be very similar to this one, geared around product and development executives at EHR vendors and other health IT vendors, where we're going to give you an opportunity to talk this through with us live, and hopefully that'll be another vector for us to get some valuable feedback and use cases from the market. I don't have dates or times for those yet. We will distribute an announcement to this distribution list once we have those set. We're still working with the event organizers to schedule those, but there will be a couple of sessions. They'll both be the same. We'll just have 2 sessions at different times to try to maximize people's opportunity to drop by and participate. Hopefully you find these helpful. We'd like to continue to keep those open lines of communication going. As I said earlier, designing with users is a big part of what we're all about, and I think we've already seen some of the benefits of that over the course of the past year, and we want to keep that going. So thank you for your time and attention today, and we look forward to hearing more from you as we continue down the path to provide better tools and services for EHR vendors.